Assalamualaikum warahmatullahi wabarakatuh and good morning to everyone. So my name is Muhammad Bustamam bin Sohaimi. ID number 012022021843. So today I'm going to present about Code Blue for subject Invasive Cardiology Lab ICL 1. So we go for the introduction. So what is Code Blue? Code Blue is an emergency code system in a hospital. So different colors could mean different emergency. For example, in Institute Jantung Negara, use Code Blue as emergency code for adults, while other codes such as Black Code emergency are for fighting in wards. So usually Code Blue indicates someone has undergoes cardiac or respiratory arrest. So we go for the case example. So, a 60-year-old male just finished undergo heart catheterization and be left at monitoring room. The patient has history of acute coronary syndrome, ACS. However, the nurse reports that the patient doesn't feel or look well following immobilized. So the patient is not moved at all. So the nurse immediately placed on the ECG, BP monitoring, and SpO2 meter. Suddenly, the nurse recognized the ECG is having a VTAC progressing to VFib and immediate call for Code Blue. So how to perform the Code Blue protocol? So first of all, the number one is CAT lab room, which must have the readiness of equipment. So such as emergency trolley and defibrillator. Patient safety of environment. So patient must save from anything danger that might affect the patients, and data information and reporting, so which can be help for the further process of the Code Blue protocol for the doctor. Okay, next. The second one is danger. So check the surrounding for the possible danger that may affect the patient condition. So for example, if the patient is positioning on the semi-folder, make sure the bed is flat. So remove the pillow and everything, check for any danger that might affect the patient. Okay. For example, another for if the patient might fall, reposition the patient carefully on the bed. Okay. So number 3 is response. Tap the patient chest hardly while calling his name loudly to check any response. So, if no response, immediately initiate Code Blue protocol. And let's see if the person or the CVT is only one CVT, attend to the patient, immediate shout loudly, Code Blue, Code Blue, Code Blue, to give everyone at the hospital to hear the Code Blue as someone having emergency. Okay, so number 4 is pulse and airways. So check for patient pulse and airway. If absent, start for basic life support. So what is basic life support? So basic life support protocol. So the patient, we need to start 30 chest compression and 2 breathing in 1 cycle. So in 2 minutes, there's 5 cycles need to be done. Okay, so 5 cycles mean there is like 150 chest compression and 6 breathing within 2 minutes need to be done for patients. After that, once while we're doing the chest compression and breathing, the emergency teams and the doctor have arrived at the scene. So immediately after done the VLS, we must place the ECG electrode and check for the rhythm. So ready to give shock if the rhythm is pulseless VT and VFib. So as a CVT also, we need to know how to handle the defibrillator. So for example, there's an image there, how the ECG will be like for VFib and pulseless ventricular tachycardia. However, if the ECG patient is asystole and PA, pulseless electrical activity, we do not have to give the shock. We must continue to CPR. Okay, so After that, repeat the process until the patient gain conscious and wait for order from the medical officer. So that's all. So, in conclusion, accessibility should know the basic life support and the code blue protocol in order to save patient life. I think that's all for me. Thank you.